Hey everybody, it's Kara Harmon, the Director of Program Services for Special Olympics South Carolina. I'm so excited today to talk to you about our 2021 Year of Health Challenge, but also just our health programs and initiatives in general. It's time for a reboot. It's a new year. It's January. It is not 2020. So we are going to move forward. We're going to get stronger. We're going to get fitter. And we're going to have fun while we're doing it. So let's get started. You might think, why are we talking about health? We're a sports organization. I'm involved through my school. Why are we talking about health? And why do we put such an emphasis on it? Well, it's one of our three main buckets of Special Olympics. Sports, obviously, first and foremost, that's what we're based on. And we feel like that is the equal and level playing field between our athletes in the community, and giving them the opportunities to experience participating on teams and just enjoying the competition. Education. We have a humongous education program through Unified Champion Schools. It has grown so much over the last few years, and it's exciting to see our educators giving the students the opportunity to be leaders in their school and make real changes to be more inclusive. So the third component and the third bucket, it's health. There's a key statement in our mission statement that says we want to develop physical fitness. We want our athletes to continue beyond their education, beyond, graduation or transitioning out. We want them to be involved with sports for their entire life. So how can they do that, and how can they maintain that? Well, it's by being healthy and taking charge of their health and being an advocate for their health care. So it's a bucket that we don't want them to forget about. We don't want to forget about. We kind of just want to make sure that you guys know why it's so important to us, and important for our athletes. So I want to play a little game with y'all before we get too deep into the program. Fact or fiction? Our first statement: healthcare professionals are well prepared to treat people with intellectual disabilities. If you said false, you are correct. The majority of healthcare professionals are not educated on how to treat people with ID. One study alone says 56% of the medical students in the United States are not competent when they graduate to treat people with ID. And it really boils down to the fact that they don't have the experience working with this population. So they don't understand that they have to give them extra time. They don't understand how to talk directly to our athletes. Our athletes can understand so much and want to advocate for their health. So having these practitioners give our athletes the ability and the opportunity to do that is so important. So this is a false statement, and one that Special Olympics is hoping to fix. So our second statement: people with ID have better access to healthcare than people without. Do you guys think that's true or false? It is not true. A lot of people think that our athletes have way better access to healthcare than people without, and that's simply not true. They have a lot of preventive health practices, such as dental hygiene, physical activity, preventative screening, and it comes down to provide them quality care. That's going to give them that extra time and extra attention that they need. Communication is another huge basis when they're trying to get the access that they need. They either don't understand or they're not comfortable and they don't know how to communicate that. Want to go, and it's hard for them to feel comfortable in those kind of situations. So our last fact or fiction: When people with ID die younger than the general population, it's due to factors associated with their disability. I love hearing when people say this because it simply is not true. And this statistic is so impactful. People with ID die younger than the general population on average 16 years. 16 years. That is a huge gap. And it's not due to their disability. It's due in the not mistreatment, but misdiagnosis or treating the illness or receiving appropriate care. That's 16 years that they could have back if they have the equal access and the inclusive access to health. So what is SOSC doing to help? How can we change some of these statistics? So the first thing is focusing on health and focusing on two sets of initiatives that fall under our healthcare program. The first one is Healthy Athletes. And Healthy Athletes, you may or may not know about it, but Healthy Athletes started in 1997, and it was a way to focus on specific disciplines, specialized care that our athletes don't necessarily receive. So there's a total of 8 different disciplines. Special Olympics South Carolina has 7 of those disciplines, and I'm going to try and remember them all. But the first one is Fun Fitness. Fun Fitness is our physical therapy discipline. So our physical therapist will look at our athletes' balance, look at their endurance, and look at their strength, and highlight any areas of concern. So if they go through a screening and there's an area of concern, they receive a referral that hopefully they can go back and get those issues addressed. There's Strong Minds, which is actually one of the newest disciplines. Strong Minds focuses on teaching adaptive coping skills, teaching what is stress, what are our stressors, what can we do to manage our anxiety, which is so important, especially now for our athletes, but also for our partners, our coaches, our family members. Taking care of their mental health is really an important aspect right now. We did Fun Fitness, Strong Minds. The third one is Special Smiles. So we have a dentistry program that will come in and screen our athletes, give them the education on how to properly take care of their teeth. And if there's any areas of concern, they will receive a referral to get those issues checked out. We have Opening Eyes, which is our optometry discipline, and this is a fantastic program. It's done in partnership with the Lions Club, and it's where those clinicians give our athletes free eye exams. And if our athletes need glasses, they get them for free. I don't know about y'all, but glasses are expensive. So it's a wonderful program. Not only are they getting free eyeglasses, they're getting sports goggles if they need them for a particular sport that they participate in. They're getting sunglasses. So it's definitely one to get your athletes to and get their eyes taken care of. We've got Healthy Hearing, which is our audiology discipline. So they get free hearing exams, and if there's any issues addressed, they'll get a referral as well. We have Health Promotion, which is our nutrition discipline. So it focuses on what our athletes are eating, drinking. It focuses on their blood pressure, their BMI. So if there's any issues that need to be fixed, they'll get a referral to see their general practitioner or a nutritionist to help manage those issues. And then there's Fit Feet. And Fit Feet looks at our athletes' foot structure. It looks at what type of shoe are they wearing. Is it the right size? So many of our athletes are in kid shoes still. So when they go through Fit Feet, that issue is addressed and they can get fitted for the right shoes and the right type of shoes, and they can walk away with that information. And then the 8th discipline, which we do not have yet in our state, is called MedFest. And MedFest really looks at those sports physicals, our medical forms, and getting those filled out and taken care of. And so the idea for Healthy Athletes was to especially train these clinical directors teach them how to communicate, what health concerns to really look for and address, and how to teach our athletes to better take care of themselves. So these clinical directors have gone through a national training. They have had their resumes approved to be trained, and then they go through hands-on experience before they're an official clinical director for our program. So you can feel comforted in the fact that these clinical directors truly want to be there and truly have the expertise to take care of our athletes. Best part, this service is free for our athletes. It does not cost them a dime to go through and get the specialized care. And it occurs at our state fall games and our state summer games. So it is definitely something as coaches, you want to get your athletes to work it in the schedule. It's typically right next to Olympic Town, so you want to make sure that is on your list to do. So what is Healthy Communities? Healthy Communities focuses on the follow-up care from healthy athletes. So our athletes receive referrals. What next? Do they have a doctor to connect with? Are those issues of concern addressed? Are those being fixed? So taking all that information and making sure that we get those athletes connected and get them seen and taken care of. There was a wonderful athlete messenger that talked about how he hated going to the dentist, hated it, hadn't been in over 10 years. And his coach encouraged him to go through Special Smiles. His coach went with him, he felt comfortable. Well, there was an issue that was addressed. The athlete did not have a place to go because he just did not feel comfortable going to a dentist. He didn't like him. So his coach called his personal dentist and said, "Would you see my athlete?" The dentist, of course, agreed. The athlete went in and the dentist told him, "I don't want to scare you, but I am seeing gum cancer." This dentist, this program, if it had not been there, that athlete might not be around to tell his story. So having the coach, having the information to really truly follow up on those areas of concern are so important. It could potentially be life and death. So we really, really want to focus on building that community of doctors that our athletes and their families feel comfortable contacting. It also focuses on providing year-round health and fitness programs. You know, our athletes might be in a season where they're going to a basketball practice this day and a swim practice this day, but the other 50 weeks out of the year, they're not really as active or engaged. So providing another opportunity to really take the time to address their health and develop more physical fitness is really important, a really important aspect of Healthy Communities, and it's something that we're focusing on doing, especially with our Year of Health Challenge. So the third component to Healthy Communities is building athlete health messengers. So we have athletes that have been specially trained to share their health stories, with partners, potential partners, but also, and more importantly, share their message with their peers. I mean, peers listen to each other more so than listening to us. And so it's wonderful to have athletes be able to tell other athletes, like, look, I enjoy taking care of myself, and this is how easy it can be. And this is what I can do to help you be in the best shape possible and be the healthiest you possible. So it's really important to engage those athletes as messengers. We have a couple in our state right now. We're looking to grow more, and we're looking to have at least one per area. So hopefully we'll have some information on an upcoming training soon. And then finally, we want to engage the healthcare community for change. We want to see more inclusiveness in our healthcare system. Having practitioners be trained on how to interact with our athletes and their families, how to advocate for a change, and provide the opportunity to kind of utilize Special Olympics for that change, I think is really, really important. And it kind of helps with our Year of Health challenge. We want to bridge the gap between us and other health organizations. So we've come up with this challenge for the year to incorporate physical fitness, incorporate nutrition every single day, but also have an opportunity where healthcare organizations can present about what it is that they do, and how our athletes and their families can access um, these health organizations, but also how they can get involved. Each theme has, or each month will have a different theme. Every month, has a theme, whether it's National Diabetes Prevention Month, Dental Health Awareness Month. So we're really going to take those themes and build them out for the year. So that particular month, we'll have those presentations from organizations to coincide with those themes. Participants can earn a monthly patch. So these patches, you can collect one, you can collect 6, you can collect all 12, but they're going to be different each month. And how they earn them is by completing that calendar that will be sent out at the beginning of every month. Those calendars will really hopefully give a guide to what participants can do each month. And I say participants because it's not only for our athletes, but it's for unified partners, it's for coaches, it's for family members. But we are encouraging everybody to participate at least in 75% of that month's activities to earn their patch. So I think that's a good number, realistic number, and hopefully as you progress throughout the year, you'll be doing 75%, 80, 90, and 100, just the more and more you get engaged. So along with other health organizations, you'll also have the opportunity to learn directly from our clinical directors, our health messengers, and other healthcare providers. So you'll see in a few slides when we take a look at what a calendar might look like. We have Wellness Wednesdays, and those presentations with the organizations or clinical directors or health messengers will always be posted on a Wednesday. So you'll be able to access those and just learn more about how to better take care of yourself and your athletes. This is just a snapshot of what our Year of Health looks like, what the months are going to look like. Obviously, they're subject to change, at least a little bit. But January, we are set in stone. We have already gotten started, but it's time to jumpstart a healthier you. So what better way than to start focusing on your fitness, focusing on some things you can do at home. We've got our Fun Fitness clinical director that will go through some easy activities that you can incorporate at home. So get up, get moving, let's get started for this year. February, we're going to focus on dental health awareness with special smiles, and it is also American Heart Association month, so hopefully we can get somebody from the American Heart Association to share their story and share how we can better take care of our heart. March, Disability Awareness Month. April, Autism Awareness Month, so we'll have some fun activities involving those two things. May, Mental Health Month. So our Strong Minds clinical director will be pulled in for that. And it is also Healthy Vision Month. So we'll pull in our Opening Eyes clinical directors to hopefully share some great insight on how to better take care of our vision. June, we're going to focus on the men. We have Men's Health Month. So there are obviously conditions and concerns that are really important to men and their health. And so we want to address those and just kind of give some education and some background on those issues, and hopefully give our men something to talk to their doctors about the next time that they're there. July, we are smack dab in the middle of summer. It is hot and it is sunny. So we don't want to forget about sun safety, taking care of our skin and protecting our skin, and why it's so important to do that. August, we don't want to forget about our feet. Our feet are important. We walk on them every single day. So we want to bring in our clinical director for Fit Feet and talk to us a little bit about what that discipline is and how to protect our feet. September highlights Childhood Cancer Awareness Month. So we just want to open the door for conversation on what to look for, how it impacts our population, and how we can maybe help make a difference in that area. October, the women are not to be forgotten. It is Breast Cancer Awareness Month, so we're going to talk about that as well as women's health. But it is also National Bullying Prevention Month and National Audiology Month. So we'll bring in Healthy Hearing to talk a little bit about the importance of ear care, and some friends to talk to us about bullying prevention. So I think that will be a really, really full, fun-packed month. November is American Diabetes Month. So we're going to bring in our health promotion clinical director to talk to us about prevention, but also how to manage diabetes if you are diagnosed with that, and the importance of taking care of yourself and eating right. And then December, we wrap up this year of health. And it's important to just reflect on your year and what your challenges were, what your successes were, and to celebrate those. So we're really going to have some fun things that month to have you guys share the things that you've learned, and how we can go forward the next year and improve on everything. So this is the example of what the calendar looks like. This was January's calendar. So you'll see like some of the activities are really fun, simple activities, and they might not be very challenging for you or for your athletes. So double it, triple it, make it a little bit more challenging. But the important thing here is to realize that you're getting up, you're getting moving, and you're doing some different things to see what exercise you enjoy the most. I think a lot of times that's the hardest thing is, you think of running or you think of walking, and that's not really your thing. But maybe swimming is, maybe going out and playing basketball is. So we're trying to give enough variation to really figure out what it is that you guys like to do. Again, I'll point out that Wellness Wednesdays will be on our social media, and that's when all of our presentations will be posted. And then at the end of the month, you've got a nice little rest day, but it's a nice little reminder too to submit your calendar for your monthly patch. So that really wraps up our presentation today. I hope you will join us. I hope you will join us on this year of health. You can email me. You'll see my email address right there to register. If you're a teacher or a coach and you want to register your whole team, awesome. Let me know. Send a roster so we can keep up with how many people are participating. But we're excited for this year, and we're excited to see all the connections that we can make, and just opening doors and bridging that gap to have a more inclusive health program. So let me know if you have any questions, and again, I hope you'll join us. Thanks so much.